Okay, I'll just launch in then. How many of your hypothyroid patients, a rough estimate, would you say struggle with continued symptoms that are difficult to resolve, despite returning to the normal population reference ranges? Gosh, that's a long question.
So I think that's quite a difficult question to answer.
Yeah.
Because, so the reason is that, you know all this, but so the vast majority of people with hypothyroidism are looked after in primary care.
Yeah.
We know that studies suggest that about 10% of people don't feel back to normal or well on standard therapy, and so it's those people that we often get referred. And so, by definition, we tend to so we don't see a lot of people with hypothyroidism, but we tend to have quite a skewed population of those people.
I think likewise.
They've got a problem.
Yeah.
Yes. So it's hard. Yeah,
Carry on.
It's hard to know really how representative of the whole hypothyroid population they are.
Yeah. So you get referred, a small amount of those people. Okay, so out of the people that you see, do you think there are distinct sort of subgroups of people with hypothyroidism? So maybe those who've been treated for cancer, or those with autoimmune thyroiditis, who are more likely to experience these residual symptoms and maybe come to you?
I'm not sure there is necessarily.
Okay.
I'm not sure there is. I mean, we undoubtedly see people from all of those categories, but I'm not sure that they're particularly overrepresented.
Yeah.
And anyone is particularly overrepresented.
Okay, so nothing stands out to you as a group one over the other. Okay. And why do you think that there are patients who appear to remain dissatisfied with their treatment? What are the common... I know everybody's different, but can you talk to me about this sort of phenomenon that occurs?
I think it's difficult to know. I think undoubtedly there are people... So I think if you went out and asked lots of people, So fatigue's just a nightmare symptom, because if you go out and ask lots of people, either with chronic disease or without chronic disease, are they fatigued, then a lot of people will say yes. And I think because fatigue and tiredness and poor energy is part of the hypothyroidism symptom complex, I think people kind of latch onto that and assume that it must be their thyroid that makes them that is the cause of the reason they don't feel well, and I'm not always sure that that's the case.
Yeah.
I think it's also true that I think we're diagnosing people with hypothyroidism at much earlier stages than we ever did. So, if you went back 50 years, you had to have a TSH. Yeah, basically your thyroid had to have completely failed, and you had a TSH of 100, and you were undoubtedly symptomatic, and you were put on treatment. I think now, because everyone gets the TSH box ticked, we're diagnosing people with very minor degrees of thyroid dysfunction, and I'm not at all sure that they're symptomatic, but I think often what happens is that people come to see their primary care physician, for instance, and say, I just don't feel right, I'm tired, I put on some weight, life isn't great, and they they tick 12 boxes, and the TSH comes back at 6, and they say, oh, that's the answer. And it probably never was the answer.
Yeah.
And that's why people don't feel better, because it was never the problem. And therefore, if you give people thyroid replacement hormone at very minor levels of thyroid dysfunction, I think we shouldn't be surprised if quite a lot of those people don't feel any better.
Yes.
I think people find that quite a difficult concept, because my thyroid's underactive, isn't it? and actually probably it's not really, or barely.
Yeah. Or it may be other sort of lifestyle factors or other things.
Well, exactly. Also, as you say, if you go out and ask lots of people, there's everybody's tired, aren't they? But actually, they don't have a medical, they don't have a disease that's causing that. It's because life is difficult, and and people have stuff going on, and whether you can be depressed, but you can just have a life that's not very easy, and that makes people feel tired and fed up. And
so do you think, I think this has come up quite a lot about, this focus on the GP practice and sort of overworked GPs and people coming in with quite difficult to identify symptoms. I guess thyroid being quite not convenient hook, but at least something to try and test. Would you say that maybe some intervention at that level, sort of between the GP level and yourselves, some sort of fatigue intervention, lifestyle intervention might actually be helpful in sort of cutting down the referrals to secondary care or helping people to live well?
I think so. I think so, because to be honest, we try and keep, so if we get referred people with symptoms, but with bang normal thyroid function on thyroxine, we really try not to see these people. And I think that's because often we get the letter, this person needs an expert opinion or a specialist opinion. And I think so, and the reason we try not to see them is multifold, is that, so one is that we probably don't really have much, so apart from explanation, really much to offer them. We're in an overwhelmed service. It's another appointment slot that goes. But I think it is mainly just that almost by being referred to an endocrinologist, you're almost reinforcing that that's the diagnosis.
Yeah.
And I think it often ends up being, and so those consultations often end up being quite satisfying for everybody, not least the patient, but also the doctor as well. And I think because you feel like you're slightly at loggerheads, that you don't really have much to offer. I mean, we may get on to talking about the kind of the other non-standard therapies for hypothyroidism, which people often come seeking, so like T3 and Armour-thyroid, and which we aren't really able to offer. And so again, if people come wanting these sorts of things, it ends up being very dissatisfying for everybody because you have to say no.
Mm.
And so people come wanting one thing and end up not feeling that they're not getting it, and that you had quite a difficult consultation and don't feel like you've been able to help that person very much. And it's all very difficult.
And do you feel then that the patients, that have been referred by the GPs, maybe that could have been dealt with differently, and their sort of expectations may have been mismanaged, maybe by other sources online and by the referral as well? Do you think there's sort of I
think that's true in quite a lot of cases. Yeah, all of those things.
Yeah.
And I think, I'm aware that so this probably doesn't apply to a lot of people, but we're certainly aware that a proportion of people that we get sent to see have that there is quite a lot of information on the internet that basically says actually the tests are rubbish and it's your symptoms that are important and that you need treating even though the tests are all normal. And that's quite a difficult thing to kind of oppose, really, or argue against when people have, because people feel, we acknowledge that people they aren't feeling very well. It's just that we're not sure that it's their thyroid or the treatment that's the cause. And also, even if we do additional tests frequently, there isn't another explanation.